Hello, everyone. I'm Dee Cunniff from the London Joint Working Group on Substance Use and Hepatitis C. We've been liaising in partnership with the Hepatitis C Trust to create a service, a very unusual service, which we'll be explaining to you. It is the Swerve service. It's a safe way to engage. That's what Swerve stands for. It's a Hackney harm-based reduction hub. Okay. So let's have a little bit of a look at harm reduction itself. We really like this quote at Swerve. Small gains for many people will have more benefit for a community than heroic gains achieved for a select few. So let's look at what we're about. So the service itself is I think it's worth saying right at the beginning that the service itself is the only service in London and maybe outside London, which runs and is commissioned by the Health Authority and runs separately from the Drug and Alcohol Service, from the local Drug and Alcohol Service in Hackney. So what we're looking to do is keeping people who use drugs alive and preventing irreparable damage. So it's the most urgent priority. So any positive change that individuals make in our lives is being acknowledged. So when we talk about recovery in the Hackney Harm Reduction Hub Swerve, we look at any positive change can be aligned to a process where people start to recover, and it should be acknowledged. Harm reduction interventions are facilitative rather than coercive. They're grounded in the needs of individuals. Okay, so we aim to help people in the interventions that they receive are there to facilitate improvements in a holistic harm reduction, not just focused on NSP, needle syringe provision, although we do provide that. And the way that we do everything that we do within the harm reduction engagement with the people in our community who come to ask for help from us is facilitative rather than coercive. So we're designed to meet people's needs where they currently are in their lives. Okay, so you can see on the right, you can see there our leaflet tells you where we are, where our main space is. And as you can see, the Swerve, a safe way to engage. What I didn't mention is that the RVE stands for resource, volunteer and engage, empower. So Swerve provides NSP advice. And when we say testing, we're talking about testing for synthetic drugs to help people not to overdose. You know, overdose is a real problem in the Hackney area and across the country and across the world. And we'll talk a little bit about that in a moment. We also provide naloxone for other organisations and for the people that we help, and people who come to ask for advice on harm reduction that maybe aren't drug users themselves, but they might be impacted by drug use. So we provide naloxone for the market stall holders in Ridley Market, because there have been people found in overdose in the local toilets, and it's often the people on Ridley Market, the owners of the stalls, that find the people. So we provide naloxone for people such as in all areas that might be affected by drug use, and then support in general in this holistic way. So to tell you where we are, our hub runs out of the CVS, which is Council Voluntary Services. So it's Hackney Council Voluntary Services. And we also work out of a mobile van, and also there is a trailer as well. So that van has a trailer. So the van can move around mobile, but there's a trailer which is static in different areas where people know where we are. We advertise where we are at different times. So we're in the main service, which is in the Hackney CVS, Monday to Friday, 12 to 4. And then we're also in the mobile van on different days. We advertise when we're going to be in a place. And we also are on the trailer, which can be left in a static position. So the outreach we do is to homelessness. There are satellites in different organisational buildings outside where we know we will meet people. Hostels, we visit hostels, and we also are now going into the city, and we go in with the van and trailer, and the trailer sits outside a homeless hostel, and then the van or the car, because there is a car, the Vito car, travels round, often near Liverpool Station. We provide harm reduction advice, resources and equipment. We test for hepatitis C, HBV. We've just started to test for that in our new plans. And we have HIV testing through our partners in helping out with HIV testing, which is Positive East. We also provide the drug tests, and these drug tests are for xylazine, nitazene, and fentanyl, because people are overdosing with the synthetic drugs. They're overdosing with the opioid synthetics, and xylazine is a synthetic drug which is not an opioid, but there is respiratory impact of that, and then ulcers can they break out over the body. So we provide testing which people can take away, little tests, and they can test their drugs. I'll tell you a little bit more about the new initiatives in Hackney at the last on the last slide. We also, in collaboration with our partners, the Wellbeing team, the Hackney Wellbeing team, who drive the van and look after the trailer, that they provide warm meals. So we liaise with them and we provide warm meals and tea and coffee when we're out and about. And we also provide warm meals and tea and coffee within our service at the Hackney CVS. We're staffed by lived and living experience volunteers, empowering them to help others. And we have a new women's service which is aimed at engaging women who need a discreet space, and this includes sex workers. Okay, so I spoke before about what makes us different. One of the things is that we are the only service that is funded completely by the local authority. We got some help at the beginning from NHS England with a grant, which was helpful to set things up. But basically, we are a separate service funded now by the Hackney Public Health, and we're the only one that is doing that, because we do not sit within the drug and alcohol service. And there are reasons for that, which I'll tell you a little bit more about. We're staffed and managed by lived and living experience individuals, which I mentioned on the last slide. And we've been supported by the Hepatitis C Trust since the beginning. The whole service came out of discussions and collaborations between the London Joint Working Group and the Hepatitis C Trust. And we found that the robust organisation of volunteers was just brilliant and has proved to be, and that they were willing also to help us to staff volunteers and staff that are lived and living. So it's not just staff, although it doesn't mention volunteers here. It's managed by lived and living experienced individuals, but all the volunteers that also are supported by the Hepatitis C Trust are lived and living. And just to remind people that living means that people who currently use drugs, and there are people that do and want to start to help improve their lives. They want to help with helping their people that need support just as much as somebody who has stopped using drugs, and this has been really successful. We're reaching people who find other services hard to reach, and we found that some people, the others, services are really, really amazing. Across Hackney, there's some great services, but perception has been over the years that people who use drugs, many do not want to go into recovery or do not want to go into the services as they're currently set up. So we have tried to match. We did a focus group which showed and matched we were able to match what people wanted for a service, people who use drugs. And between 69 and 82% of people that we have helped do not attend the drug service, the local drug service. So we're meeting people where they are, and we're building relationships, and we expand our service as we need. We've done some learning along the way, and if something doesn't work, we document it. We've got a report that's coming out, an evaluation of the first year, which we hope can help people as a blueprint for developing services, and includes what went well and which could have gone better. Okay, so our impact. In its first year, the service has distributed harm reduction equipment to 354 contacts. Many more people engage with the service for advice and information, but do not collect NSP, as I mentioned. That is important. All sorts of discussions happen about harm reduction. 1,427 people engage with the service over the year, starting in March 2024 to March 2025. 8,393 items of equipment have been dispensed, and it's increasing each quarter as people get to know about the service and as we embed our outreach into hostels. Naloxone has been provided 129 times. That is increasing as well for the same reasons. And 355 drug testing kits for xylazine, nitazene, and fentanyl have been dispensed from the service. So what's next? You can see we've got the leaflet on the right hand side, and what we did is we merged together the logo and the colouring for the branding of Open Doors, who provide equipment and support for people who are in the sex working. And so we brought together, and this one is for women, although we do also liaise with them for male sex workers as well, and trans sex workers if needed. So what's next? We've moved to our permanent base. We're expanding our women's service. I think the main thing to say about the women's service is that we've now got a space which is discreet. As we mentioned, this is needed, a specialised service, and we're talking to our partners all across Hackney, all the different organisations we work with. We're talking to them about how we might work with them with this space, this discreet space that we have for women. We're expanding our work in the city. I mentioned hepatitis B testing. It's really only started to get going after the first year, but it is now happening. We're also have been over the time, and we continue to explore safer inhalation pipe provision, which is against the law at the moment to provide pipes unless in research. And we are working with the London School of Hygiene and Tropical Medicine and Release, finding ways to be able to hopefully help the Home Office and the local police to be able to accept pipe provision. And the final point is we're liaising with the Loop, who have been engaged by Hackney Public Health to provide drug testing for drugs like fentanyl, nitazene and xylazine and other drugs. And we're working with them because they need to find ways to be able to contact our community, the community that need harm reduction and use drugs. So it's been good speaking with you. If you have any questions, you can contact us on the email and telephone numbers that will be shared. Thank you so much.